Hi, this is Nick Yagoda. I'm the Chief Medical Officer at CommUnityCare. I wanted to take a quick moment to talk about the COVID pandemic locally in light of some of the public health messaging over the weekend. The Delta variant of the virus that causes COVID has been alarming in a number of ways. It moves very, very quickly because it is more infectious than some of the prior variants. It is possibly more severe in its complications and outcomes, but we still have a lot to learn about that. But I wanted to highlight some key features. First off, if you're vaccinated, you are much safer than you were a year ago. If you're unvaccinated, now is much more dangerous than it was before. And we'll go into a little bit of why. The vaccines dramatically reduce your risk of infection in the first place, any sort of illness, the need for hospitalization, or even death as a result of COVID-19. And even if you do get a breakthrough infection, your risk of transmitting that virus to others is significantly reduced if you're vaccinated. So it is a completely different ballgame if you have your vaccine than if you do not. That said, I think with the more recent news about breakthrough infections, there's understandable anxiety that the vaccines may not be working as well as they are. And I want to speak specifically to that because there's been some misinformation or misunderstanding about what some of the studies have shown. First off, if a vaccine is 95% effective at preventing COVID-19, that means out of 100 people who are exposed to the virus, 95 of them will be protected. But that does mean that 5 of them may get sick. Again, for those who are vaccinated, you're much, much more likely to have a very mild illness, if you have an illness at all. Many find themselves infected but asymptomatic. There are a very, very small percentage of those who are vaccinated who do become sick and may even require hospitalization because of severe disease, but those tend to be individuals who have increased risk because of immune compromised state or otherwise. So if out of 100 exposed people, 5 we expect to get infected, that means that out of 1,000 people, we would expect 50 people to get infected. Out of 10,000 people exposed, we would expect 500 people to be infected and maybe get sick. So you could quickly see that as the number of individuals who are vaccinated grows, so we should also expect the number of people with breakthrough infections to grow. Again, our country has done a great job of rolling out vaccines over the past few months, and our vaccine coverage in Austin, Travis County is actually fairly decent. So we do have a large number of individuals who are vaccinated now. I think it's almost up to 1.5 million, which means that we should expect a fair number of breakthrough infections. So where breakthrough infections may feel common, they're actually not common, again, because the vaccines work so well. So that difference between it feeling like it's a common occurrence and actually being a common occurrence is very different. So again, it's just a little bit about the perception and the way media may be messaging the risk about breakthrough infections. The other thing I wanted to speak to now also is risk for kids, because 12 and under remain a large proportion of our population who are not allowed to be vaccinated right now. We do hope to see in the next month or so emergency use authorization given for the mRNA vaccines to be used on kids between the age of 5 and 11. We're still waiting and watching this closely, but our hope is that that's not too far off. But in the meantime, the best way to protect our kids from getting infected is to make sure that the adults are not getting infected, which means we need to continue to push vaccination amongst every eligible adult. Additionally, as the kids are getting prepped for school, I want to equip them with high-quality masks, ensure that everyone at school is vaccinated if they can be, and try to encourage ventilation within those rooms because we know this is an airborne virus. So lastly, just for those, it's important to speak just to those who remain unvaccinated. There has been an epidemic both of the coronavirus itself as well as misinformation about the coronavirus. And there are many people who are vulnerable both to the virus and to misinformation, and we need to treat them with compassion and a sense of understanding and curiosity about what their risk tolerance is, what their feelings are about their own wellness and the wellness of those around them. It is our duty to, again, attend to the health and wellness of everyone, inclusive of those who are not yet ready to get the vaccine. So I encourage us to approach it with compassion and a sense of curiosity. Again, this is a very difficult time. We're all going through a lot, just having to gear up again to manage a stage 5 pandemic. But we can do this. We've done it before. And please look to one another as a voice of reason, as someone to listen to. And thank you for all the hard work you've put into this and all the hard work that it'll take to get through the rest of this. My gratitude to all of you. Thanks very much.